This is part two of my video relating to insulin usage. In part one, I mentioned, I basically focused on the use of insulin or how insulin relates to diet and body fat loss. I mentioned that there's two opposing camps. There's one camp that says that insulin is basically an innocent bystander in causing obesity. In fact, it's not insulin itself, rather, it's the intake of excessive calories that promotes body fat. And according to this particular philosophy, it really doesn't make much difference how much insulin you secrete. It's all dependent on calories. And also, it also, what really controls body fat, according to this group, is that it's actually, your body weight is actually controlled by factors produced in the brain. For example, there's what they call adipokine, or a protein secreted by fat cells called leptin, and leptin actually plays a large role in controlling appetite, and also basically relates to the size and the function of fat cells. So according to this theory, one of the main causes of excessive eating and consequent body fat synthesis is a resistance to leptin on the level of the brain. Now that's what so basically this one group says that, the insulin theory of obesity and promoting body fat has been overplayed. The other camp, represented by people such as Gary Taubes and several others, or Dr. Atkins, anyone who advocates a low carbohydrate diet, is that insulin is the central player, and carbohydrates, a combination of excessive carbohydrate intake coupled with excessive insulin release caused by the carbohydrate intake, is the main cause of obesity. My statement in that last video was, I felt that the situation which was being kind of overlooked by the insulin isn't the villain group is that most people with excessive amounts of body fat tend to be insulin resistant. So every time they eat carbohydrates, their body kicks out a little bit too much insulin. They have what they call hyperinsulinemia, which is an excessive release of insulin. Now, it's true that insulin alone won't make you fat unless you consume an excess amount of calories. However, what is known about insulin, it's the most potent fat storage hormone in the body. And also, when insulin is secreted, body fat is either being synthesized or it's being blocked from release, or as used as a source of energy. So if you think about it, if a person is hyperinsulinemic, for example, if they're insulin resistant and they're eating a high carbohydrate, low fat diet, if the calories go low enough and their activity level increases, they will definitely lose body fat. But in the meantime, it's going to be a very slow, long process, because their insulin is being kicked out every time they eat those carbs, and it's helping to maintain their body fat, so they're kind of working against themselves. And it takes an extreme amount of willpower to stay on a diet low enough in calories to promote weight loss or fat loss under such conditions. Now, there's another type of insulin resistance I didn't mention, which is not related to body fat at all. It's basically called age-related insulin resistance, and with this is related to insulin resistance at the level of muscle tissue. A lot of older people, for some reason, their muscles become resistant to insulin, and a lot of this has to do with a long-term lack of physical activity. And in these people, the insulin resistance at the level of the muscle actually causes them to lose muscle, because one of the main functions of insulin is an anti-catabolic effect. And the reason why these older people lose muscle is because they get in a situation called anabolic resistance, and the anabolic resistance is related to a longer, a less effective blood perfusion within muscle, because a little known effect of insulin is that it stimulates vasodilation, or perfusion, blood perfusion, especially in the muscle, because it stimulates the production of nitric oxide. And now nitric oxide, of course, is produced from the amino acid arginine, and it dilates blood vessels and allows greater blood circulation within muscle. Now, why is the blood circulation in muscle important? Because increased blood circulation allows greater uptake in the muscle of amino acids, which promote muscle protein synthesis. And if you don't have enough blood circulation in the muscle, you're not going to get a sufficient level of protein synthesis, or you're going to have a greater level of muscle protein breakdown. And this is what happens in older people. They get a situation called, or a condition called sarcopenia. Now, okay, rather than continue on and on about this insulin resistance effect, let's go into this particular second part. I want to focus on the use of insulin by bodybuilders and athletes. So the first question is, why wouldn't a bodybuilder actually use insulin? And it reminds me of a little situation that happened a couple of years ago, where I was in Gold's Gym, and I was talking to a guy named Tim Belknap, who won the Mr. America and Mr. Universe titles. I think he won the Mr. America, if I remember correctly, in 1981. And we were talking, this was in the early 90s, when insulin was just starting to come into heavy use in bodybuilding. And I mentioned to Tim about this kind of new use of insulin. And this had special relevance for Tim because he was a type 1 diabetic. A type 1 diabetic is a person who cannot actually produce insulin because the beta cells of their pancreas, or the Isle of Langerhans cells where insulin is actually synthesized, were destroyed because of an autoimmune reaction. As a consequence, type 1 diabetics like Tim have to use insulin because they can't make it on their own. So when I mentioned this to Tim about how bodybuilders were beginning to use insulin, he was aghast. He couldn't believe it. He said, Jerry, I don't understand why anyone without diabetes would even consider using insulin. I've been using it most of my life, and I would do anything to get off it. That was his exact words. I would do anything to get off it. Which raises the question again, why do bodybuilders use insulin? Well, there's a number of reasons. First, they feel it has potent anabolic effects in muscle, especially when combined with steroids, anabolic steroids, and growth hormone. I've written several times that it's the combination of insulin, growth hormone, and anabolic steroids that is thought to be one of the underlying causes of these massive physiques that you see now in professional bodybuilding competition, where these guys compete weighing 260, 270 pounds and above. There's some sort of synergistic effect between those three hormones that causes a massive amount of muscle growth. But there are actually more practical reasons why some bodybuilders consider adding insulin to so-called anabolic stacks. For one thing, one of the side effects of growth hormone is that it tends to cause what they call hyperglycemia. Hyperglycemia is an elevated blood glucose level, which can cause a lot of problems from a medical point of view. Now, if they take insulin, it kind of balances out the hyperglycemia, which is induced by growth hormone. So in that sense, insulin and growth hormone are synergistic. Now, anabolic steroids, of course, increase muscle size by increasing muscle protein synthesis. And what insulin mainly does is it has an anti-catabolic effect, like I was mentioning with the older people. It tends to preserve muscle. It prevents excessive muscle protein breakdown. So the thought is by combining insulin with anabolic steroids, you're getting an increase in muscle protein synthesis combined with a break on excessive muscle protein breakdown, and that adds up to a significant amount of muscle growth. Now, there's still another reason why insulin is thought of is to be of use in, let's say, bodybuilding circles or athletic circles. Insulin promotes the activity of what they call the rate-limiting enzyme for glycogen synthesis in muscle. Glycogen is basically stored carbohydrate. It's long chains of glucose. It's stored in liver and in muscle. And in muscle, it not only provides the dominant source of energy during anaerobic training, such as bodybuilding, but it also tends to hold a little water in the muscle. Each gram of glycogen is stored with 2.7 grams of water. Now, your muscle tissue is already 72% water. if you have a full, let's say, store of glycogen in there, the thought is that you're going to have a much fuller appearing muscle. So, in other words, the bodybuilders feel that by using insulin, insulin stimulates the rate-limiting enzyme. In other words, it stimulates the enzyme that converts glucose into glycogen. They will have more efficient glycogen synthesis in muscle. And of course, that also means they can train harder and also get better recovery. But as far as a lot of bodybuilders, though, and I've seen this online, I've seen insulin referred to as the most anabolic hormone of them all. Now, if you look at that statement, it implies that insulin is actually more anabolic than growth hormone, testosterone, and all the anabolic steroids. But let's look at that statement. Is it really the most anabolic hormone? That would imply that it increases muscle protein synthesis, since that's basically what anabolism in muscle really means. And the truth of the matter is that in various scientific studies, they've shown that the only way to get a true muscle protein synthesis effect from insulin is you have to either give massive amounts, which increases the chances of serious side effects, such as going into convulsions or coma, or you have to have the only other condition where insulin becomes truly, let's say, anabolic is when you have a large amount of amino acids in the blood. In fact, insulin is not anabolic at all unless there is an accompanying rise in amino acid levels in the blood. And it's actually the amino acids, rather than the insulin, that's producing the anabolic effect. The insulin actually permits the amino acids to provide the anabolic effect by increasing, let's say, blood perfusion or circulation in muscle, right? Okay. Of course, I mentioned about the nitric oxide release, but insulin has another side effect in that, as I mentioned in a previous video, this appearance of this bloated gut look in bodybuilders, that actually didn't really start appearing in competitive bodybuilders until insulin came on the scene shortly afterwards. There's no definite cause and effect that's been shown between insulin and the bloated look, but the fact that it didn't appear until insulin started to be used in bodybuilding indicates that insulin must play some type of role. It just hasn't been specifically identified as of yet. Okay, now, when the bodybuilders use insulin, I mean, there's all kinds of misdirections on the internet, and could be dangerous. I mean, some of the dosages recommended for insulin are very, very dangerous. And the methods of using insulin could be very dangerous. As I said, insulin, one of the main effects of insulin is that it lowers your blood glucose levels by helping to basically push glucose into muscle. But if you take insulin and you don't have a certain amount of carbohydrates available, you can actually cause your blood glucose to go so low that your brain, which requires a certain amount of glucose to function, it can basically, you can basically go into convulsions. In a worst case, you can even go into a coma. So, it's very dangerous. I was reading one medical study. There hasn't been a lot of medical studies about bodybuilders who had side effects from using insulin. But in one particular study, I was reading about a bodybuilder who actually injected 320 units of insulin, which is a massive amount. Now, I don't know whether he took carbohydrate with it or not, but I mean, that's insane. I don't know where he got the idea. To make a long story short, this guy went into severe convulsions, and then he passed out and he had to be brought to the hospital. Luckily, he survived. They gave him insulin infusions. They gave him a couple of the medications. He survived. There's been several cases on record of bodybuilders at contests actually passing out, just falling on the ground because they took insulin shots and their blood glucose got too low. They didn't time the carbohydrates right. From what I read, and again, what I'm about to say, there's no scientific basis for this, but it appears that the average dose of insulin for bodybuilding purposes is about 10 units a day. And when you take the 10 units a day, they always tell you to take about 10 grams of a rapidly absorbed form of carbohydrate within 15 minutes of the injection to prevent hypoglycemia. And yet I've seen on some sites people saying that you should just take the insulin and don't worry about the carbohydrate because it's not necessary. This is actually deadly advice. I mean, this could actually kill you. And then there's the type of insulin, which, like I say, is usually it's short-acting insulin. Typical examples are Humulin R or Humalog. Taking the long-acting insulin, there's different types of insulin. Some act quickly, some act longer. Some last much longer. There's the longer ones are a little bit iffy. I mean, they can cause, again, if your carbohydrate's not timed right, you can go into hypoglycemia. Some people suggest taking whey with carbohydrate with your insulin, which really doesn't make sense because it takes about 60 minutes for whey even to hit the blood. So the whey thing, I mean, the idea is if you take the whey, the insulin is going to, push the amino acids in the muscle, increase muscle protein synthesis. It really doesn't make any sense because whey takes at least 60 minutes to even hit the blood. So basically, another problem with insulin is that if you do it wrong, and again, it's an idiosyncratic thing. It doesn't happen to everybody. As I said, insulin is probably the most fattening single hormone. It stimulates, it tends to hold on to fat in your fat cells, and it tends to stimulate body fat synthesis. There's a danger that insulin can actually stimulate body fat if it used too often, too wrong, or in the case of too much carbohydrate intake, it can actually maintain body fat. And there's still another problem with insulin, and this is something that a lot of bodybuilding athletes don't know, is that insulin stimulates the release of an adrenal steroid hormone called aldosterone. Now, what aldosterone does is it tends to retain sodium in the water in the blood while stimulating potassium excretion. Along with the sodium, you have water retention. Now, growth hormone also stimulates aldosterone. So if you take insulin and growth hormone, you're having a double whammy effect on aldosterone release, which can cause in some individuals a rather large amount of water retention. Now, a lot of bodybuilders will take diuretics to offset this effect. But when you take diuretics, now you're into another danger territory where if you take too much, you can remove too much water, producing a flat effect where even your vascularity or the appearance of veins just under the skin, that can actually disappear if your blood volume goes too low from excessive diuretics. So you can see it's a very delicate balancing act. So that's another problem. But as far as a lot of times people will say, well, it's a good idea to take insulin to increase exercise recovery. But again, as I noted in the first video, amino acids alone stimulate insulin. The leucine is pretty potent at stimulating insulin release. And, you don't really need to take a lot of carbohydrates after your workout because the protein alone, if you're taking like a whey protein, you're going to get enough of an insulin release as by itself. So, and there's another thing to consider is that from the point of view of longevity, they found that the people that live the longest, the people that live into their age 100 or above, these people have one thing in common: they always have low insulin levels, low resting insulin levels. And they've shown that people with low resting insulin levels tend to have longer lifespans, and conversely, people that have high elevated insulin levels have increased mortality rates. And there's still another point to consider is that elevated insulin levels are associated with increased cancer rates because insulin, along with insulin-like growth factor 1, they stimulate cellular growth. In the case of insulin, it stimulates cellular growth, especially in the colon. So there's a strong relationship between high resting insulin levels and colon cancer. So that's something to consider, these guys that are pumping insulin into themselves all the time. And there's still another factor that highlights the danger of using insulin, and that's the fact that there's a protein produced in the brain called insulin degrading enzyme. What this stuff does, as the name implies, it breaks down insulin in the brain. There is insulin produced in the brain. Now, but besides breaking down insulin in the brain, this particular protein also removes another substance called beta amyloid, which is a protein thought to play a major role in Alzheimer's disease. So if you're taking in too many carbohydrates, for example, your insulin degrading enzyme is working to get all that insulin produced by the carbohydrates. It's working to get it out of the brain. In the meantime, it's allowing beta amyloid to build up to the point where, in some cases, this can kind of set the stage for future Alzheimer's disease. So what's the bottom line? Should any bodybuilder or athlete consider using insulin? I say no. It's too dangerous. It's true that, the growth hormone will offset a lot of the side effects of insulin and vice versa, but you're playing with fire when you play with insulin. I mean, like I say, it can keep you smooth. It's not really a muscle protein synthesis type of situation, it's not worth it. So my recommendation is to keep away from insulin. If you want to manipulate insulin, it's very simple to do. You're taking after your workout, if you're taking a fast-acting protein such as whey, and you're taking let's say a high glycemic or rapidly absorbed source of carbohydrate, you combine the two, you take them after your workout, you're going to get a 37% increase in glycogen synthesis, and this is caused by a superphysiological release of insulin. So by doing it this way in a natural sense, you get the best advantages of insulin without the possible side effects of insulin. So again, you could manipulate insulin on your own. So that's it for this video, and I just want to also suggest that if you really want a lot of in-depth information about nutrition, exercise science, supplementation, hormonal therapy, I strongly suggest that you subscribe to my Applied Metabolics newsletter at www.appliedmetabolics.com. Take care.